Hi, very good afternoon to everyone joining us today. It's a Saturday, 21st of May. Thank you so much for joining us. My name is Dr. Shazaan. I am part of Oraliah Dental Clinics. This is a set of new videos, educational videos for patients under our Smiles for Miles campaign, right? Today's topic for discussion is lasers and how do they actually help in dentistry? Why do most patients prefer lasers and how it helps in a complete healing process, right? Lasers, like most people know, are very famous in surgical procedures. Yes, most people know that lasers are very expensive, but they also need to know why lasers are preferred, right? Two, three basic types of lasers and how lasers help in dentistry is what we're discussing about today. Now, the extent of lasers being used in dentistry can be broadly classified into two different types. You have soft tissue lasers and hard tissue lasers, right? Hard tissue lasers is obviously for something to do around the bone or something to do around tooth surfaces. Soft tissue laser is more for the gums and collagen based tissue, fibrous tissue that you can excise, that can also be used for biopsies, so on and so forth. Most clinics today prefer using laser therapy for gingival surgeries, minor gingival surgeries, even to a certain extent, major gingival surgeries as well. Lasers in dentistry and in general surgery are used in operation theatre surgeries, which are done under general anesthesia and is by far the most preferred. Now, top three reasons as to why lasers are preferred in surgery. Number one, there's not much of bleeding to there is no bleeding absolutely compared to surgeries that happen when you have a scalpel and when there's an incision done. For example, if you have to undergo a gum surgery where your gums have really receded compared to how it used to be before, there's something called a traditional flap surgery that's done. You excise, you open the gums, you expose the bone, everything around the tooth, all the bacteria, all the tissue that needs to be excised is excised, and then it's put back together and it is sutured with resorbable or non-resorbable suture as your clinician finds it fit. Now, the advantage of laser is you don't have to do an excision. You can use the laser from the outside around the tooth. There's very minimal bleeding, and you don't even have to do suturing after that. The healing is accelerated because there's not too much of there's not too much of tissue cut, there's not too much of reflection of the tissue from the bone or near the tooth area, and everything is intact and the healing happens from inside. And you've successfully disinfected the socket, successfully disinfected and sterilized the area around the teeth, so it heals better. Now, let's immediately jump into patients who have medical complications. The most common complication today for anyone would be diabetes. Patients who generally have diabetes have been asked by the doctor to get a blood sugar check done on what their current blood sugar level is, and this is what helps people decide should we go ahead and do a conventional surgery for them in case they need a gum surgery, or should we go for laser. Most cases here with us, with Oraliah Dental, we always advocate the use of laser, especially for gingival surgeries. Why? Because while the patient on one side is controlling his dietary habits and controlling his blood sugar level from fluctuating too much, we can support the patient for gum surgeries through laser. Recently, we had a patient who had a pretty bad overall oral health with quite a few teeth in grade 3 mobility, which means, in simple terms, they're beyond saving and you cannot save them, or basically the prognosis is really low. We were successfully able to disinfect the entire mouth using laser, and now whatever teeth were in stage 1, stage 2 of being mobile, which means shaking, now they're showing a lot of improvement. And this is something that we advocate to a lot of patients. Coming from a patient's perspective, this entire session is on patient education. Coming from a patient's perspective, what we've seen is a lot of reservation from patients as to why should I do a laser surgery and should I even do this? It's so expensive, and can I not do the conventional one? You just have to trust your dental practitioner after they show you what you're going through at the moment, show you what are the ways we can fix your teeth, fix your gums, and then it's entirely your call. And as always with Oralia, we have options on how we can help you with financially for treatments. So we move the financial aspect completely out of the picture. Now after that, it's just the treatment, right? The most common laser therapy that's done for gingival issues is something called LANAP, which is laser assisted new attachment procedure. LANAP basically helps your teeth and the gums. The gums are supposed to be touching the teeth. If there's anything in between them, laser helps to clear any infection in between the gums and the teeth, and then it'll help join back together, and there'll be better attachment with that. Now, lasers just not used for gum surgery. Lasers can be used. What we use them for is for teeth whitening, which is we use the teeth whitening agent on the teeth, and after that they are activated by the laser light. Shows much better results, faster results. Yes, it's a little price sensitive for a lot of people, but you get impeccable, very good results. Lasers also can be used for people who have dental caries. If you have decay, and if this is minor decay between 3 to 4 layers of how it's going down inside the teeth, we can use lasers to remove decay. Not something for external and extremely deep ones where you have to do deep caries management, but surface lesions can be removed by lasers, and especially in people who have a phobia going to the dentist just because of the handpiece that we use, the drill that we use, and in those cases we can use laser. Lasers are used in different capacities across across the board with dentistry. It's used in gum surgeries, it's used in bleaching and tooth whitening, it's also used in decay, and we can also use it repeatedly as a prophylactic thing. Even while doing root canals, a lot of procedures, a lot of practitioners use laser assisted root canals and laser disinfection while doing root canals, and these have shown far more superior results comparatively. Now, reservation for our patients mostly is, of course, the cost, and the second part is will this damage my teeth? Will this bring about more sensitivity? Will it bring about irreparable damage and all of that? We are here to tell you no. None of this is, first of all, there's no damage, and even if it's damage, it's on purpose just to remove whatever infection is already there in your teeth, and teeth, gums, bone, all of that, and definitely reparable. The reason why we do this is to improve the entire quality of the oral cavity, and this way you're able to complete your treatments, and once the treatments are done, the uptake in the body is incredibly fast, right? The healing is better. In short terms, no bleeding, no healing. No bleeding, no delayed healing, and much more acceptance towards soft tissue, right? That's with laser entirely. The last part we wanted to confirm with the audience today, if you have any doubts in terms of laser, when it comes to pricing, in terms of treatment, we are working on some collaterals that we'll be sending across to everyone. Whoever wants a copy of this, you can drop us a DM and we'll definitely email it to you. If you'd like this presentation to be a little different, or if you'd like it to be in a certain way, please leave us comments and do let us know. Thank you so much, and if anyone has questions, we'll definitely like to answer them. Hi Venkata Lakshmi Swami, how are you? Namaste. Are there any questions? Hi Mahira, how are you? Good afternoon. How can I help? So is laser RCT painful? Okay. So laser RCT doesn't necessarily mean that the entire start to finish of the procedure is done using lasers. RCT has a process and a protocol where there's access opening, there's preparing the canal, it's called BMP, and then you do obturation. So lasers are used after BMP is done, and especially where at the end of the tooth, if you end up having an infection in that area, that's where it is. Let me show you a model of what I have here in front of me. Now, if this is the tooth, right? And imagine if this is the tooth and this is where you're getting a laser done. That's an implant, by the way, and something that we've covered in our previous sessions. So that's the tooth, and this you have something here, which is a periapical infection. What happens is after you do the root canal, you will have to run laser from the top till the bottom. What happens is the laser part goes and disinfects this entire area, so that if there's any hidden bacteria, any hidden infection, all this gets cured. So will it be painful? No, absolutely not. You will be given local anesthesia, and it will not. If anything, this will only do things better for you. And once that's done, please don't forget to get your crown done, and that's it. Thank you so much for asking the question. Very important question. Is there anything else that we can help anyone with? Any more questions? All right, I think that's it. Thank you so much for joining us on a Saturday afternoon. I think we've taken 12 minutes of your time. Have a great weekend. Do get in touch with us if you need anything. Thank you very much.